And when you have data, you cannot analyze it because it's large volume of data. You know, so the problem with the challenges with surveillance is that you need data, you can't capture it, and when you want to capture it, it's very difficult to capture and difficult to analyze. So if I'm asking you, India, please give me the trends of AMR, national AMR data, nobody has that. We're building surveillance now. It's a work in progress. But you have hospitals that can come from trends. But tertiary hospital, private hospitals don't reflect the evolution of AMR in the community or in districts across the country and the variation across India. So you see that we don't know anything about it. And you want to sell to the public and other sectors that, oh, this is a big problem. And the other issue that is very important as well, and that there's a push for integrated surveillance, meaning that you need to have AMR data from animals and humans and analyze it together, is that we don't know how much of the AMR resistance in animal sector contribute to the resistance in the human sector. Basically, by taking a lot of antibiotics giving a lot of antibiotics in animals, how much does it contribute to the rise of antibiotics in humans? We don't have that data. So you can see that the first thing you want to do is surveillance, because surveillance and research. But the point is that you need to count cases. You need to understand where it's serious, where it's less serious, which antibiotics are more serious, and other. We only have sketchy pictures of the situation. Of course, more data is available in developed countries, but the problem here is surveillance in low and middle income countries. In this region, we only have low and middle income countries. We don't have high income countries. So it's a big issue, you see. And we have published data to show that the biggest burden of AMR is this region. I can expand a little bit, or we can discuss it later, but I want to go to the next slide. So what do we do here at WHO? Of course, we don't do anything alone. It's very important, but for simplicity, I'm going to show you some activities, but focusing only on surveillance, but what we personally in my department are doing for surveillance, but I'm not accounting for something like, for example, I put here, AMU surveillance is huge. But this is more areas from Dr. Clara, who is focusing on this, but it's essential. So let me get started with AMR surveillance in humans. It's basically having national data. We don't have it. And I can use some data, situation about this. Second thing is surveillance of AMU. She showed you the methodology, but there's still the discussion on how to do it, standardizing it from one country to another, or from one region to another. We're at this stage. So it's early implementation or even planning. Then the laboratory capacity.